Hello, today we have Aisiku, co-CEO and chairman of the board of VSee Health, trading on the NASDAQ under the ticker VSEE. Welcome to the show.
Great. Thank you for having me. It's a pleasure to be here, and I'm looking forward to the time we have together.
iDoc, which you founded, focuses on high acuity services like EICU, telestroke, and tele-neurocritical care. Can you give us an overview of iDoc's specialized services and how they fit within VSee's broader telehealth mission?
Certainly. I think when I founded iDoc, the main gap I found was that as someone who was a neurointensivist and hence the heavy neuro in the early stages of our development, was that the brain was this organ that was kind of the black box. And so even in highly densely areas, it was difficult to get that expert knowledge diversely spread to different patients. And so that's really was my motivation as a clinician, as a physician. How do I treat patients equally across different areas? And so that's how we started. Over the years, and if we think of how telehealth and telemedicine is done, there's a huge outpatient component. We took our high acuity concept and thought of it from an inpatient component. So the neurointensivists, the cardiac intensivists, the pulmonologists, people who do EEG. Over the years, what we've now gone to do is that VSee Health really represents both ends of the spectrum. And think of the specialty services, orthopedics, neuro, all of these things, both in an inpatient and outpatient setting, but delivering equitable access, a bridge from the patients to the physicians to the hospital system. And so the platform we have totally allows for all of that. And now we can really do this in a scalable global manner. And starting with what is a high acuity service. So if you can do all the high acuity services like ultrasound, intubation, really high specialty things, that really allows us to also focus on the simple but larger aspect of audiovisual clinic communication. And so with iDoc and VSee Lab coming together, we now have this broad mission of transforming digital health into what we feel is the next wave of healthcare.
Physician burnout and specialist shortages, especially in intensive care, as you know, have reached very critical levels. How does iDoc directly address these issues, and what impact do you see this having on the healthcare system?
It's an interesting concept. First of all, if you step back and look at healthcare, we've been predicting healthcare shortages in certain areas, and critical care has been one of them for 20 plus years. Now we've all talked about how growing educational debt, reduced physician manpower, and an aging population, which means physicians also who need to train the new doctors, we're also losing them. Then you insert, this crazy event called COVID that brought out the telehealth, but it also brought out for frontline workers, these high acuity workers, just a certain degree of burnout. And the literature now has shown that mental health suicides have increased dramatically over the years, and physicians are actually well above the population in these areas. The fact that physicians have now experienced an opportunity to practice a paradigm shift in being able to use telemedicine, the opportunity for a blended practice really is how we help the burnout and the specialist shortages. If those specialists can now be thought of as being able to practice across the country, not just across the local platform. So in the good old days, a doc would have to drive to 3 or 4 hospitals to go see his patients. There's mechanism now where he can be at one and see all of those patients. The fact that he can have a more balanced life, and which is really what drives the burnout aspects for physicians. And so we've got the burnout and the human capital problem. And this is where iDoc, VSee Health really helps leverage that problem.
iDoc provides essential intensive care services to major hospital systems, long-term acute care facilities, and even federal institutions. How big is the overall market opportunity you're addressing, and how much market share have you already secured?
Certainly. The telehealth industry itself is projected to be over 250 billion by 2024. The digital health industry is actually even larger, reaching closer to a trillion when you look at it from a global perspective. We are a microcap, small component of that, but the opportunity to grow, capitalize on this industry is enormous.
AI, data analytics, transforming healthcare. How do you envision AI being incorporated into iDoc's offerings, and what role will it play in supporting physicians in improving patient care?
So iDoc has started before COVID, and the telehealth aspect of it is already ingrained. AI is a natural aspect that's coming one way or the other, and we're just prepared to take advantage of it and leverage it into the future as healthcare grows.
With iDoc's focus on intensive care and specialty services, Emo, how do you see VSee and iDoc's combined offerings appealing to health systems that are looking to enhance both primary and critical care through telehealth?
The beauty of the combination is that, in essence, we are a turnkey solution where we both do the platform, the telemedicine services side, as well as the billing aspects, but we do it in a way where it's a la carte, meaning you can have it all or you can pick individual ones, which is our unique offering.
Lastly, Emo, for the investors watching, give us the essential value proposition. In a few words, why should anyone take an interest in VSee right now?
It's really simple. We're a unique value added company that truly understands the SaaS and services by providing you a scalable, secure, and dynamic company that evolves in a nimble way. And when you put all those things together in what we know is a growing industry, we're poised to be one of the leaders in the next few years.
You put it succinctly and very powerfully, Emo. Thank you.
Thank you.